I'm Dr. Stephen May. I'm the Regional Medical Director for the Sullivan County Regional Health Department, and we thought we'd take a few minutes and try to answer some common questions that the public may have about the H1N1 flu vaccine.
So if I get the H1N1 virus shot, will I get the flu?
With the injection, there is nothing alive in it that can give you anything. The injection is a kill vaccine. The live attenuated nasal spray does have a live virus, but it's been damaged so bad that it really can't replicate and grow. So as a result, you may see a little more in the way of fever and aches just for a day or two, maybe a little stuffiness, but otherwise that's all you're going to see with the flu mist.
Are there any risks to getting the H1N1 vaccination?
At present, the risks are minimal. Other than maybe getting a headache, some muscle aches for a day or so. Otherwise, the vaccine is found to be extremely safe, and we're not seeing in the doses that we've administered through the health department hardly any side effects at all.
At my age, would I be better possibly not to take it, or would it be more in my favor to take it?
As far as benefit, it's beneficial to receive it because it does provide protection. However, those in the older population are not in the specific target group. We're seeing this disease particularly attack younger children and those with medical conditions much more severely than those in the geriatric age group. So this is just the opposite of what we normally see with seasonal flu, where seasonal flu tends to hit the older population much harder.
Is the H1N1 nasal spray as effective as the shot?
In the seasonal flu vaccine, we found the efficacy of the nasal vaccine to be about 85%. However, there is some cross-reactivity with previous strains that may have circulated. With this present dose of the H1N1 nasal vaccine, we have found it to be just as effective as the injectable form.
My main concern with the H1N1 vaccine is the safety of it. I just don't think I have enough information to, make a really good decision on whether it's safe or not, and I'd like more information on that.
This vaccine has been used worldwide and has been used in South America, Argentina, China, multiple other countries, and the safety profile has been exceptionally safe. And we have not seen much in the way of side effects at all, other than what you see with the regular flu shot, such as maybe a little achy for a day or two, maybe a mild headache. With the live virus, you may get a low-grade temperature.
Is it true that the H1N1 vaccine has not been tested?
The vaccine was rushed into production, but using standardized techniques that we've used for years to make the seasonal flu vaccine. It is made in the same identical way that we make the seasonal flu vaccine, and the current results indicate that it's just as safe as the seasonal flu vaccine.
I heard there's mercury in the vaccine. Is that true?
There is a compound that is commonly used in lots of medications and preparations to preserve it. That's called thimerosal. It's been used commonly in many vaccines and in many other medications that you get. So in the multi-dose vials, there is a compound called thimerosal to keep it preserved and fresh. However, in the pre-filled syringes that we give to the infants, it does not contain any thimerosal.
How often do I need to get an H1N1 vaccination?
The seasonal flu vaccine you get once a year. The H1N1 vaccine, if you're over the age of 10, you only need one shot or one dose of the flu mist. If you're less than the age of 10, you will need 2 doses separated by 4 weeks.
Okay, where do I go to get the H1N1 vaccine?
Currently, vaccines are being distributed through the Department of Health, and a large amount of vaccine has been distributed also to hospitals and healthcare centers. You can look for vaccine by going to the Tennessee Department of Health website and looking at the flu locator. They're keeping that up to date to tell where vaccine can be found, or call your local health department. We're very hopeful that the vaccine will be in many of your pediatricians and doctors' offices very shortly.
How do I keep from getting the flu virus?
The first is practicing good old-fashioned hand washing, covering your cough when you sneeze, The other thing that you need to do is practice social distancing. If you're ill, you need to stay about 6 feet away from other people because this virus is spread by droplet spread. Also, if you're ill, you need to stay home and stay away from other people. That's always good to do. Then practicing appropriate respiratory etiquette, such as covering your cough and using tissues and Kleenex to blow your nose into, and then of course keeping your hands washed. Don't touch your eyes. It's critical that we get our target groups vaccinated because these are the people that we're seeing that are becoming so ill and actually seeing increased numbers of deaths, particularly in the pediatric age group. So our target groups are those children, particularly 6 months to age 24, are especially important that we get vaccinated. We're looking at caretakers of those who have children less than 6 months old to receive the vaccine because the 6-month-old can't be vaccinated. We're looking at those 25 to 64 years of age who have underlying medical conditions such as asthma, lung disease, neurodevelopmental disorders, because these are the ones that are dying and getting critically ill from the actual illness. Pregnant ladies have a 600% increase of dying from the H1N1 flu. It's critical we get our pregnant ladies vaccinated to protect them. Certainly healthcare workers, those who are in the forefront, taking care of those who are ill, are high risk to get the disease, and so we want to vaccinate our healthcare workers until we have a population of people that can take care of those who are sick. And finally, the last on the target groups, but not least, are those who are older than age 65, and we anticipate having plenty of vaccine for those, but we're asking that they wait until we get the little ones vaccinated first to protect them, because they're the ones that's becoming the most ill and having the most hospital complications and death.